Hey guys, welcome back to our channel. And in this video, we'll be seeing two short topics. One is the MDS or otherwise called myelodysplastic syndrome, and the other one is the Langerhan cell histiocytosis. So first, let's see myelodysplastic syndrome under the following topics of types, pathogenesis, morphology, and clinical features. First, let's see what does the myelodysplastic syndrome refers to. So the myelodysplastic syndrome refers to a group of clonal stem cell disorders characterized by maturation defects resulting in an ineffective erythropoiesis and pancytopenia. The term pancytopenia here refers to decreased count of all three types of bed cells such as RBCs, WBCs and platelets. So next, the types of the myelodysplastic syndrome. It is of two types. The one is the primary and the other one is the secondary. So the primary dysplastic syndrome is of idiopathic in origin, whereas the secondary myelodysplastic syndrome is therapy related due to genotoxic drugs or any other radiations. So the all myelodysplastic syndrome transforms into an AML in its later stage, whereas the therapy related myelodysplastic syndrome has a greater tendency to develop into acute myeloid leukemia. Next, the pathogenesis of the myelodysplastic syndrome includes gene mutations in the TP53 gene or the deletion of the chromosome 5q, 7q, and 20q, monosomy of chromosomes 5 and 7, and trisomy of chromosome 8, which has a gene called MYC gene. Next, morphology with respect to the bone marrow picture. The bone marrow cellularity is mostly hypercellular in myelodysplastic syndrome, but sometimes it may also be normocellular or hypocellular in nature. And the characteristic feature of myelodysplastic syndrome is the disordered differentiation, which includes the following: dyserythropoiesis, dysmyelopoiesis, and dysmegakaryopoiesis. So dyserythropoiesis refers to defect in maturation of the erythroid series, and the dysmyelopoiesis refers to defect in maturation of the myeloid series, and the dysmegakaryopoiesis refers to defect in maturation of the platelet series. So first, let's see the features of dyserythropoiesis. So dyserythropoiesis shows the presence of ring sideroblast, megaloblastoid maturation, nuclear budding, and bridging. So the ring sideroblast. The word sidero means iron and the blast means the immature blasts. So the ring sideroblast are nothing but iron-laden mitochondrial granules which are present in the immature erythroblast cells. And these iron are specifically stained by a stain called Prussian blue stain. And the next is the megaloblastoid maturation, which shows presence of the immature erythroblast and many nucleated RBC progenitor cells. And the characteristic finding in this erythropoiesis is the nuclear budding and the bridging. So, as you can all see in this picture, you see the presence of immature erythroblast and presence of the nucleated RBCs, and these cells are called the nuclear budding and bridging. So this cell shows presence of nuclear budding and bridging. And with respect to this picture, it is the Prussian blue stain of the bone marrow, which shows presence of blue stained granules, which are nothing but the iron-laden macrophages, and these cells are called the ring sideroblast. Next, features of dysmyelopoiesis includes presence of abnormal neutrophils with decreased number of secondary granules, toxic granules, and or Dole bodies. And the characteristic finding of dysmyelopoiesis is the pseudopegular Hewitt cells. So these pseudopegular Hewitt cells are nothing but the hyposegmented neutrophils with only presence of two nuclear loops. And some neutrophils may also lack complete nuclear segmentation. And the peripheral blood picture in dysmyelopoiesis may also show increased number of myeloid blast cells. And in this picture, you can appreciate presence of myeloid blast cells, and these cells are called the pseudopegular Hewitt cells, which are nothing but the hyposegmented neutrophils with only two nuclei. Next, the features of this megakaryopoiesis shows presence of either abnormal megakaryocytes or pawn-born megakaryocytes. So abnormal megakaryocytes shows cells with large single nucleus, whereas pawn-born megakaryocyte shows cells with multiple and separate nucleus, which is the characteristic finding in this megakaryopoiesis. So in this picture, you can appreciate presence of large megakaryocyte which separate three nucleus, and this cell is called the spawn wall megakaryocyte. Next, morphology with respect to the peripheral blood picture. The peripheral blood picture shows presence of pseudopecular Hewitt cells, giant platelets, macrocytes, which are nothing but the large red blood cells, poikilocytes, which refers to presence of abnormal shaped RBCs, and also presence of myeloid blast cells, which are of less than 10%. Next, the clinical features of the myelodysplastic syndrome. The myelodysplastic syndrome usually occurs in older adults of 70 years of age. And the characteristic finding in the myelodysplastic syndrome, as I've already mentioned, it is of pancytopenia, which is nothing but presence of all the three: anemia, neutropenia, and the thrombocytopenia. So in anemia, the hemoglobin value is less than 10 gram per deciliter. In neutropenia, the value of RBC cells is less than 1800 cells per microliter, and thrombocytopenia shows presence of less than 1 lakh platelets per cubic millimeter. And due to these features, the patient presents with fatigue, recurrent infections, and bleeding tendencies. Next, moving on to our next topic, Langerhan cell histiocytosis, which I will be discussing under the topics of pathogenesis, morphology, and clinical features. So, the Langerhan cell histiocytosis is a clonal proliferation of a special type of cells called immature dendritic cells, which are also called the Langerhan cells. So, this term may sound similar to another term called Langerhan cells, but these two are different. So the Langerhan cells are the immature dendritic cells, whereas the Langerhan cells are a type of giant cell which are found in the granulomatous inflammation. So don't confuse between these two terms. Then moving on to the pathogenesis, the main mutations involved in Langerhan cell histiocytosis is the BRAF mutation, and less commonly TP53, RAS, and MET gene may also be involved. Next, the morphology of the Langerhans cell histiocytosis shows presence of the Langerhans cells, and these Langerhans cells have abundant and vacuolated cytoplasm with vesicular nuclei, and these vesicular nuclei contain linear grooves or folds, and these presence of linear grooves or folds give rise to an coffee bean-like appearance. And the electron microscopy shows presence of a characteristic cells called Bierberg granules. So these Bierberg granules are nothing but pentalaminar tubules with a dilated end producing a tennis racket-like appearance, and these Bierberg granules are composed of a protein called Langerhan. Now let's see the picture of the morphology. So here in this picture you can appreciate the Langerhan cells, which has a vesicular nuclei, and the nucleus is grooved, giving rise to that of a coffee bean-like appearance. And this is the electron microscopic picture of the Langerhans histiocytosis, where you can appreciate these Bierberg granules, which resembles to that of an tennis racket, and these Bierberg granules has the pentalaminar tubules, which is nothing but the highlighted one. Next, the diagnosis of Langerhans cell histiocytosis can be done by immunohistochemistry markers, which includes HLA-DR, S100, and CD1A. Next, the clinical features of the Langerhans cell histiocytosis. It may present as three clinicopathological entities such as the multisystem multifocal Langerhans histiocytosis, or otherwise called Lederer-Sueve disease, or the unifocal unisystem or the multifocal unisystem Langerhans cell histiocytosis, or otherwise called eosinophilic granuloma, and pulmonary Langerhans cell histiocytosis. So the etiology: the multisystem multifocal usually seen in age of less than 2 years, whereas unifocal unisystem is seen in older children and adults, whereas the multifocal unisystem is seen in young children, and the pulmonary Langerhans histiocytosis is commonly seen in the adult smokers. With respect to the features of each of the types, the multisystem multifocal presents with seborrheic eruption, hepatosplenomegaly, and lymphadenopathy. Whereas in unisystem unifocal or multifocal unisystem, The features include Langerhan cells that mixed of variable number of eosinophils, lymphocytes, and plasma cells, and it shows a characteristic triad called the Han-Schuller triad, which is nothing but a combination of calvarial bone defect, exophthalmos, and diabetes insipidus. Whereas the pulmonary Langerhan cell histiocytosis shows presence of Langerhan cells in the lung biopsy. On summarizing the topic, the myelodysplastic syndrome shows characteristic 3, this erythropoiesis, that is myelopoiesis, and this megakaryopoiesis. So this erythropoiesis shows presence of immature erythroblast cells, nuclear budding and bridging, and nucleated RBCs, and presence of ring sideroblast which are stained by Prussian blue stain. Next, the myelopoiesis shows presence of pseudopecular Hewitt cells, which are nothing but hyposegmented neutrophils with only two nucleus and presence of myeloid blast cells. Next, the megakaryopoiesis shows presence of pound ball megakaryocytes with three or more separate nucleus. So with respect to Langerhans histiocytosis, it shows presence of Langerhans cells which has grooved nucleus giving similar appearance to that of an coffee bean, and in electron microscopy the Langerhans histiocytosis shows presence of Bierberg granules which has a similar appearance to that of a tennis racket. So with this we are completing this video, and thank you guys for listening to this video, and I hope I was pretty clear with the topic. And if you guys have any doubts or queries regarding to the topic, do mention them in the comment section, or you can reach us at medimentorz@gmail.com too. And if you like the lecture, do show some love by liking the video and subscribing to our channel MediMentorz, and do share with your lovable batchmates. And thank you.